Wanted to share with you just a little bit of a general college overview and share some information with you about Bryan. So our college was founded in 1926. So we have been doing nursing education for the last 95 years. And now we are expanded beyond obviously just doing nursing education. So we started as a nursing program at that time and have now expanded our programs to a multitude of other programs that we'll share with you today that you'll get to learn about. We are unique in that we are a college within a medical center. And so one of the things that is unique about that is we have a tremendous focus on clinical preparation for our students here at Bryan. And so having and utilizing and leveraging a medical center is certainly something that our students take great pride in and also benefit from tremendously in multitude of ways. Our student to faculty ratio is low, but even more importantly, our clinical to faculty ratio is here at 1:7. So that means our clinicals are faculty-led clinicals. And so for every 7 students is kind of an average clinical group size for us. And so we have a faculty overseeing those clinical experiences. So there's tremendous continuity between the lecture classroom environment and the clinical spaces. This past fall, we did reach a record enrollment here at Bryan. So we are up to 790 students, as you see. And with that being said, we are still definitely able to keep our class sizes small. And on average, you will experience a classroom size between 20 and maybe 25 students here at Bryan. As I mentioned, we definitely are very, very clinically focused programs. 1,200 hours, 1,250 hours or so is really the minimum number of clinical hours that any student would do in any of our programs. So we take tremendous pride in providing a high quality clinical experience for our students here. We don't have any prerequisites for admission. And so students can join us directly out of high school. All of the classes that are necessary to satisfy any of our degrees are offered within the context of the college. And so students are not required to have any completed coursework done before they would be admitted to or begin their program of study here at Bryan. Also, along with that, in terms of the application, we do not assess any application fees. And so the application process is made very, very streamlined. On average, probably takes students 10, 15 minutes or so to complete the application for our programs here. We do offer a dual credit college credit program for high school seniors that I'll touch on just here briefly. That is through our Early College Access program. So the Bryan Early College Access program is designed for qualified high school juniors and seniors. They are slated to take the very first course in that program, which is a Intro to Health Professions course. It's fully online, so the program is widely accessible to students wherever they might be. That program allows, as I mentioned, students to take up to 12 credits of general education classes in its entirety. This is our admissions team. So Stacy Dam, who's our Dean of Enrollment Management. Timmery Kozichek is a recruitment coordinator who works with our graduate level programs primarily. Myself, as I serve as recruitment and diversity coordinator, as mentioned. And here is a little bit more regarding our early college access program. So the program is ACE scholarship eligible, which is a tremendous value and benefit. So an ACE scholarship, if you're ACE scholarship eligible, that would cover the cost of that coursework in the BCAP program for that particular term. The BCAP program will be offering classes beginning this summer, as well as the fall semester this year as well. You can see the tuition is offered at a discounted rate of $200 per credit hour. You can learn a little bit more about that on our website, bryanhealthcollege.edu there, and you can see that right there on our website there. So here's a little bit of information on our undergraduate programs of study. And so we offer a large plethora of health science education here at Bryan, as you can see here. And we're going to take some time going through these programs throughout the course of our time this afternoon. But this just gives you a preview of those programs that we do offer at the undergraduate level. Here at Bryan, we do offer graduate study programs as well. And that is certainly something that I think enables our college to be quite comprehensive in its offerings, from everything as far as a basic nursing assistant course here or a phlebotomy course, all the way through a doctorate degree in education, nursing education, or a doctorate degree in nurse anesthesia. So students really can have a fully comprehensive educational experience through Bryan from start to finish there. Here's a little bit of our admissions requirements in terms of our programs individually, because the admissions requirements do vary depending on the program of study. As you can see with that first line item on the ACT, so our ACT is not required for submission for our sonography ultrasound program. For nursing, it's also not required. And for the biomedical sciences degree, it is a test optional, as you can see as well for our healthcare studies option. Our healthcare studies program, we'll talk a little bit more about moving forward here as well. But that program provides students with a non-clinical track, but it does offer some tremendous postgraduate options, particularly with a medical lab science track that we have recently began to offer for students. So you can see from a GPA standpoint, the minimum high school GPAs that apply for each program across the board there. The biomedical sciences degree does require a slightly higher GPA, as well as a slightly higher math and science GPA, as that program does have a little bit more of a concentration in the math and sciences. And so it's important for students to really be strong in their foundation as far as the math science degree, and as well as their general education courses there. Now, you'll also see in terms of the very last few lines on this particular slide, when it comes to what else being required, there are no letters of recommendation. We do ask that you submit reference, name, and phone number at the time that you apply. And for our sonography and nursing program, there's also an interview component to the admissions process. Additionally, for the sonography program, we are wanting to see that you've taken some sort of additional explorational activity, whether that be a job shadow, maybe you've taken part in something here at the college, observing our lab, something with that just kind of shows us that you've sort of taken the extra step to learn more about the profession in and of itself. So we're currently accepting applications, and this is just really a graph that gives you kind of some different timelines, because different programs do have varying application cycles and different application deadlines, as you can see. So for the biomedical sciences degree, the application final deadline would be May 1st for enrollment into that program. For the spring term of that program, we would ask all applications be finished by November 1st. So some of you may be currently in college, or you might be a high school student who's graduating early potentially, and have a spring start of 2022 for that program, as an example. And you can see the other respective application deadlines for each of the other programs. We're currently accepting applications for the nursing program and for the spring term that you can see. So May 14th would be the deadline. October 25th is the deadline. If any of you are juniors, we have a priority application deadline for students starting the program the following August of 2022. So October 25th is that deadline for the priority applications. May 14th would be the deadline for students starting in January, the spring of 22. Okay, so now would like to introduce you to Dr. Teresa Delahoyd, who is the Dean of our undergraduate nursing program.
Hello. My name is Dr. Teresa Delahoyte, and I am the Dean of Undergraduate Nursing here at Bryan College of Health Sciences. And I have had the privilege of being at the college for the last 20 years. So it's hard to believe that it's been that long already. Been a nurse for almost 25. So it is the best profession, I think, that there is, but I am a little biased with that. So want to give you a little information about the nursing profession. It is rated as one of the top 25 best healthcare jobs in the nation. And the starting salary is very good. And around here in this area, starting salary is right around that $26.50, $27 and on up dollars per hour. And that's before shift differentials. So that is something that's good for parents to hear as well, that you will have employment. Your son or daughter will have employment after they graduate and will be able to pay back those student loans and be able to support themselves, that sort of thing. So unemployment rate is very low. In fact, we have a nursing shortage everywhere across the United States, and particularly here in Nebraska as well. And that's just going to continue to increase with the demand of 25% increase by 2025. There's lots of incentives also that facilities are actually promoting to be able to get people to apply to work as RNs in their facilities. And so those include sign-on bonuses and tuition reimbursement. So lots of attractive incentives after graduation. A lot of times we get the question about why should I choose a BSN? I could certainly go and get my associate's degree a lot quicker, be done in 2 years and start working. And to some aspect, there is some truth to that. Yes, sometimes you can complete that a little sooner, but oftentimes you're spending about the same amount of time simply because you have to have all those general education requirements done before you actually enter into an associate's degree program. And that can take anywhere from another year or two. And really a BSN is going to give you more of an edge and better prepare you for that nursing profession, because a BSN program has hallmark courses in it, such as community health, evidence-based practice, and nursing leadership and management. Those are courses that are not in the associate's degree program, yet that is information that is vital for a nurse to be able to have. And so going and getting your BSN right away is actually what we recommend. And that way you are better prepared to give that best patient care. And it has actually shown in the research that a BSN prepared nurse provides better quality outcomes, lower patient mortality. That has definitely been researched and studied. And they did want to have 80% of their nurses to have their BSN by 2020. We didn't quite reach that in the United States, but we got really close to that. So with our program, we are fully accredited, and that may not mean a lot to you right now, but if any of you are thinking about going back to school and getting a graduate degree at some point in time, you will want to have graduated from a fully accredited institution. And so our college is accredited through the Higher Learning Commission, and our School of Nursing also has specialized accreditation through ASIN. That is our specialized nursing accreditor. And Ash already mentioned this, but we have excellent clinical experiences. Our partner with our main clinical partner is Bryan Medical Center. And that is not the only place that our students go for clinical, but it is the one where they spend the majority of their time because of our connection with them. And we really value that face-to-face, hands-on, faculty-led clinical. We do have the most clinical hours in the state, over 1,237. And students can also choose to do a nursing special topics course once they are complete with semester 5. And if they want to do something over the summer to earn even more clinical hours and more experience, they have that ability as well. We also are expanding our program out into the Hastings area. And so we have secured clinical spots with Mary Lanning Healthcare as well as Grand Island Regional. And we're very excited about those opportunities that are coming forward. So if anyone on the call is looking at a possible Hastings location for our program as well, that is definitely an option. And we prepare every single one of our students for that licensure exam. So that is an exam that all graduates have to take after earning their degree in nursing. They take this exam to be able to practice as a registered nurse. So we can grant the degree, we can't grant the license. License is granted through whatever respective state that the student would like to go and live in and then subsequently work in. So they have to pass an exam to be able to do that. And we are very proud of the work that we do throughout our entire curriculum to ensure that our students do have that successful pass rate. So you can see we have very good pass rates there, and also 100% employment. Our graduates do not have any trouble finding jobs after graduation, just simply because there is such a need, and also because they're so well prepared and sought out. And we're also very proud that we have been ranked #1 in the state and number 59 nationally out of 1,700 schools by rncareers.org. So an exciting time for us with that. Our curriculum definitely is our success. And as I mentioned already, we have the most clinical hours in the state. Our clinicals start sophomore year. So they do their general education courses the first year, and then right away, first semester, sophomore year, we get all of our students into a clinical setting. And that is in the skills lab initially, and then they move on into acute care settings such as the hospital. We do have contracts with over 200 clinical sites, and our students go into a variety of places. So as the curriculum continues and as the student progresses through, they're exposed to things such as not only acute care in the hospital, but rural settings, community settings, the correctional facilities, schools, outpatient mental health. So the list goes on and on. There's a lot of different places that they get to go. And we've already talked about our great faculty to student ratios. And then we also have an excellent simulation center. And that is something we're very proud of with our new renovation. So our college has 10 simulators. That is 2 infant, 1 pediatric, 1 birthing, and 5 adult simulators. And we have a director, Dr. Barb Sittner, who oversees that entire simulation center. And our students do spend a minimum of about 50 hours and start doing that already in their second year. So that first semester of sophomore year, when they're starting those clinicals and learning health assessment foundations, they're getting into that simulation center at that point in time too. So it is an extremely proud place that we like to showcase. And if you are able to come to campus at some point in time and see that, we would love to be able to show that to you.
Hey, welcome. My name is Dr. Katie Sladke. I am faculty in the undergraduate nursing program here at Bryan, and I am in our state-of-the-art simulation center today. First of all, I have my mask on. I'm in a room with a few other people, so we are all going to be masked today. And so just talking loudly, hopefully you can hear all of us. I have been teaching here at Bryan for, I'm in my 6th year. I've been teaching a little longer than that, and have been a nurse for over 11 years now. And as I said, I teach in our undergraduate nursing program. I teach at the very beginning of our nursing program here in semester 3. So Teresa mentioned that our nursing courses start in semester 3 along with the clinical experiences. And so we came up to the Sim Center here to introduce you to Nursing Annie and just kind of showcase the awesome resources that we have up here. So again, I teach in the first semester of nursing courses. I teach a course called Health Assessment, as well as a professionalism course called Issues and Trends. And in health assessment, we teach our students how to assess their patients from head to toe. And so one of our clinical experiences is coming up to the simulation unit and practicing on a mannequin such as Annie. And she is one of our high fidelity mannequins. You can see she blinks every so often. She's actually breathing. We can take her vital signs. And our students get good practice doing a head-to-toe assessment on her. So they can look at her pupils, and those will react to her. We'll listen to her heart sounds, her lung sounds, her bowel sounds with a stethoscope, and hear all of those sounds that the body will make. We'll assess her different pulses throughout her body and things like that. And so it really gives our students a chance to practice those assessment skills in a safe environment, where they can make mistakes and feel comfortable making those mistakes before they actually go and assess a real patient in the next semester at the medical center. I'm going to pass it off now to my colleague, Professor Fox, who's going to talk a little bit about the middle of our program here.
Hello, everyone. My name is Amanda. I teach 6th semester, so that's their junior year. And I teach family health nursing, so that is OB, so labor and delivery, mother, baby. And we do send students up to Omaha to Children's Hospital. One neat part about our simulation experience that we have is we have a mom that the students come in, don't know much about her, and they need to figure out what's going on. And then she delivers, which is really neat to see the students' reaction to that. And then we have some other critical issues that the students may not see in the clinical area that they need to think and process through and know how to treat the situation or what to do with the situation. Like Teresa said, we use simulation throughout all of our semesters. What else do we need? We know that we also use Tori, that's what I wanted to add, which is one of our newborn simulators. And she is really neat because she's mobile. So we can take her into our classrooms so the students can learn heart rates, lung sounds, murmurs. They can learn what, bad lung sounds sound like, or if there's crackles. So it's nice that some of our simulators are mobile so we can take them where we need them for their great experience. I'm going to turn it over to Dr. Kapler, and she'll talk to you about our senior year.
Hello, I'm Dr. Robin Kapler. Like Professor Fox said, I have been a faculty member at the college for a little over 10 years, and I have been a nurse for almost 30 years. I've done a wide variety of things, but the bulk of my experience was in critical care, which aligns with the course that I co-teach. So first semester of the senior year, we have a course. It's not a curse, it's a course called Nursing Care 4. And it is the fourth of 4 med-surg courses. And in this course, we focus on critical care, critical illness. Our clinical sites, we have faculty-led clinical in the intensive care and the progressive care units. Students go to the emergency room. Students do a 12-hour night shift where they are precepted one-on-one with a critical care nurse. And students also do a couple of different observations and also spend some time in our recovery room. So a diverse experience within the critical care world. We use simulation a little bit different in our course. We bring students to the simulation center before we ever go out into the faculty-led clinical world. And that allows us to introduce students to some of the equipment that might be new to them, such as ventilators, a cardiac monitor, multiple IV pumps and medications, some different invasive lines. And we actually give students hands-on practice where they can work with those and feel comfortable with how they feel and how they work so that when they go into the clinical environment, it's not quite as new. The other course of the semester that I teach is community health, and they also use the simulation center to simulate some different community health experiences that students may or may not be able to have. Simulation Center has been a complete blessing to us during the pandemic. It's allowed us to continue with clinical experiences, but maybe in a little bit different way. We're fortunate that we also can have some collaboration with other disciplines, such as can be collaboration in simulation between sonography and nursing, or our Doctor of Anesthesia graduate program with some undergraduate nursing. So it really is a collaborative effort as well, and something that we are incredibly proud of, that just builds upon a strong curriculum that we already have and helps make it even stronger. So thank you for joining. Please come take a campus visit. Please take advantage of the multiple other things that we offer here in the College of Nursing, and be a blue healer.
Hello, my name is Amy Kenobi, and I am the Dean of Healthcare Studies here at Bryan College of Health Sciences. I want to take just a few minutes today and talk to you about 3 of the degrees available to students within our Healthcare Studies division. So the first degree I want to talk to you about is actually Hello, my name is Amy Kenobi, and I am the Dean of Healthcare Studies here at Bryan College of Health Sciences. I want to take just a few minutes today and talk to you about 3 of the degrees available to students within our Healthcare Studies division. So the first degree I want to talk to you about is actually a degree in Healthcare Studies. So Healthcare Studies is a bit of a choose your own adventure degree. So this is a degree for students who are interested in working in healthcare, but maybe thinking they're not actually interested in working on the clinical side and aren't interested in one of our clinical programs or a program that prepares you for clinical work. Here you're going to pick 2 concentrations that interest you. So you can pick from things like biomedical sciences, healthcare management, public health. You pick 2 and combine them together in a degree that works for your specific career goals. And then that combines together to make your healthcare studies degree. Also, as part of that degree, we're going to pair you with a faculty advisor that you'll work really, really closely with to do some career exploration, and then a senior capstone project where you're going to actually go out and do an internship in the area that interests you, and then complete a senior capstone paper write-up all about that experience. We feel like that really prepares you so you're ready to walk out the door and take that next step into whatever career interests you the most. Many of our students use this as a stepping stone towards a master's degree in social work. That's some of the outcomes that our recent students have had, but here you really do have a ton of options based on what sort of concentrations you pair together, and then again, that senior year internship experience. So here are just some options that would be available to you in terms of careers with a degree in healthcare studies. So working in public or community health, non-government organizations. So think of pairing people and finding people resources to improve their health. You can work in a clinic or a physician's office in a non-clinical capacity, long-term care facilities, and you can see some of those other options that might be available to you. The next degree I want to talk to you about is our biomedical science degree. So the biomed degree is primarily thought of as a pre-med, pre-PA, pre-graduate study program, but as you'll see, that's not the limit of what you can do with this degree either. So the biomedical sciences program contains all the prerequisites needed for admission to medical school, PA school, but you could also use it for a pre-pharmacy school track or a pre-PT track, or maybe you're interested in research. You want to go to graduate school and get your PhD. This is one of our recent graduates, Nicole Beckman. She's currently a first-year medical student at the University of Nebraska campus up in Omaha. We're incredibly proud of her. If you're not interested in graduate school, biomedical sciences can also prepare you though for lab work. So you could be a research assistant, you could work in product development. All of that would also be options with a degree in biomedical sciences. So a little bit more about the degree. We're really proud of this degree in that we don't just prepare students to get into medical school, PA school, graduate school, but we prepare them to be successful. There's a really high level of critical thinking integrated into the curriculum to help students feel ready and prepared when they walk into medical school or PA school. We routinely hear from our alumni and from the programs that they attend how well prepared our students were. This is a program with small class sizes. We think that's really important for helping students be prepared and giving them that one-on-one faculty interaction. So you're typically going to be in a class with around 10 students. The degree itself contains a research experience that you'll complete over the course of your last 3 or so semesters here with the program. That experience is great when you go to apply for a graduate program, whether it's medical school, PA school, a PhD program. They're going to want to see a research experience. That research experience also pairs you with a faculty mentor who then has a ton of data on you that they can use to write up letters of recommendation when it comes time to actually submit your applications for medical school, et cetera. One of the things we're really proud of in this program is the exposure our students get to our cadaver lab, which I'll talk about here in a minute. I've already said how proud I am of this program, but our outcomes speak a little bit for themselves. So over 90% of our graduates who apply for PA school and medical school and graduate research programs have been accepted. So again, just really, really proud of the outcomes of this program. So a couple of the resources available to students when they're in the biomed program are our plastinates. So these are individuals who donated their body to science. Unlike a cadaver, this is a long-term option. And we use these in teaching our anatomy and physiology coursework. And you can see the nerves, the skeletal muscles face to face. The experience that many of our students come back and tell us really was incredibly beneficial and sets them apart when they get to PA school, when they get to medical school. The way they felt like they were better prepared than their peers was their experience in our cadaver lab. So we are committed to our biomedical sciences students getting the experience in the cadaver lab, not viewing a prosected cadaver, which you'll have in many other undergraduate programs, but actually participating in the cadaver dissection themselves. So we acquire new cadavers every year for our biomedical sciences program. The students are in there, they get to use the bone saw, they get to use the scalpel. This is an experience you get your second year. And again, this is truly one of the things that makes our program unique. The last degree that I want to talk to you about is our sonography degrees. We have two different programs. Our sonography program is ranked in the top 15 in the nation. So sonography is a clinical degree, and a sonographer uses sound waves to see inside the body to produce an image that helps physicians diagnose and treat patients. And you can see several different cool sonographic images on this slide right here. So in terms of career options in sonography, there's a lot of different variety and options available to you. So sonographers can work in a hospital working with critically care patients. They can work in doctor's offices, or they can work in outpatient clinics. So lots of options for you in terms of what you want in a career and where you might want to work. A sonography profession is incredibly interdisciplinary and interprofessional. So you are working with nurses, doctors, working collaboratively to help advance the health of the patient. Sonography is a great option in terms of salary. So the Nebraska starting salary for sonographers, both of the programs I'm going to talk to you about here in a second, starting at around $55,000 to $60,000 a year. So it's an up and coming profession with a great starting salary. So we actually have two different sonography majors. Our first one is our diagnostic medical sonography degree. This is a bachelor's degree that you can complete in 3.5 years. You have over 1,000 clinical hours prior to graduation. One of our hallmarks at this institution is academic and clinical excellence, and you're going to see that in the sonography program. So we have extensive clinical hours. We have lots of different clinical sites for students to attend, and that's just going to give them that really strong clinical foundation before they head actually into the profession. At the end of this degree, you are eligible to sit for two different board exams, an abdomen and an OBGYN registry exam. We are currently sitting at a 100% first-time pass rate on both of those exams for the diagnostic medical sonography degree, which is just a huge testament to how well our faculty prepare students throughout that degree. Our other sonography program is our dual major cardiac and vascular sonography degree. This is again a bachelor's degree. This is a 4-year dual major. Again, really extensive clinical hours. Here we're looking at just over 2,000 clinical hours that you would complete prior to graduation. We hear back from employers. One of the things that we routinely hear when we talk to employers is surprise at how well prepared our students were, which we think is always great to hear. And it's again a testament to those clinical experiences that we can provide. Students who complete this degree are eligible to sit for two different registry exams, an adult echocardiography and a vascular technology. Again, our current rate for that is a 100% overall on both exams and a 93% first-time pass rate. So again, just a really high pass rate. We feel really proud of how well our students are prepared, and it's a testament to our faculty and the commitment that they have to student success. So those are the three programs available through Healthcare Studies. healthcare studies, biomedical sciences, and sonography. I am incredibly proud of all three of these programs and what they can prepare students for. My contact information is on the college website. If you have any questions or want to talk more about any of these programs, you are more than welcome to reach out and we could set up a time to talk about them.
Hi, my name is Stacy Schutz and I'm an assistant professor for the CVT program. Today I have some students here with me and they will introduce themselves.
Hi, I'm Jennifer. I'm a sophomore student in the CVT program.
Hi, I'm Megan. I'm a third-year sonography student here.
Hi, I'm Chris. I'm also a third-year sonography student.
Hi, I'm Tyra. I'm also a third-year cardiovascular sonography student.
So Jen, can you tell us why you chose the profession of sonography?
Yes, I had a close friend of mine had some negative healthcare experiences until a sonographer helped her get diagnosed with cancer.
Thank you for sharing that story.
Yeah.
Megan, can you just tell us what it's like on a day-to-day basis here as a student?
Yeah, so normally I have class 3 days a week, and then I have one lab that's about 3 hours long. And then most of the time I will go to clinical every 1 or 2 days out of the whole month throughout the school year.
Great, thanks for sharing your experience here at the college. Carissa has a echocardiogram pulled up for us, and this is an actual live image of Tyra's heart that we're showing. So what we're looking at right now is a 2D image where we can see the structures of the heart, and we can conduct a thorough assessment by our 2D images. We can also use color Doppler. So Carissa, will you go ahead and put the color Doppler on for us? And will you tell us what we're seeing with that?
So the colors are representing the direction of the blood flow. So the red and blue will be, the red will be towards the transducer and the blue will be away.
Let's go ahead and put spectral Doppler through there. Good, go ahead and freeze that image. And Carissa, can you describe what's going on with that waveform there and what we're looking at?
So this waveform will tell the severity of the diastolic dysfunction, and this would be normal.
Good, and that also basically just shows us the flow through the mitral valve. So we can also look for any sort of valvular pathology there with that mitral valve. So Megan, can you tell us some other reasons as to why we would do an echocardiogram?
Yeah, so a lot of reasons are your doctor can hear a new murmur and we can check out the valvular disease that may be present. If you've had any previous heart attacks, we can also see the damage that it could have done to the endocardium as well. And then if you have any risk or a chance of getting a stroke, we can also see things that are accompanied with that.
Great, well thank you for joining us today. If you have any questions about the CVT program, feel free to email me at stacy.schutz@bryanhealth.org. Thank you.
My name is Dr. Renee Hathaway, and I have two of our cardiovascular sonography students here today. We are going to be showing you a few things in vascular sonography. With vascular sonography, we scan using transducers. And do you want to show that, Macy? Using a transducer, we'll put gel on it, we'll send sound waves into the body, and we'll go up and down the neck. But we'll scan all the way down from the head, actually to the toes. We'll do arms, we'll do legs, we'll do abdomen for a variety of different reasons. We'll scan for maybe if someone comes into the emergency room with stroke-like symptoms, maybe some slurring of speech, weakness on one side of the body, or maybe they have blood clots, or maybe parts of their vessels are tearing apart in dissections. And so we, in vascular sonography, we will do a variety of different scans. So if you like to never be bored and scan from the head all the way down to the toes, this may be a great program to look into here. So we have just a few things to show you here. We are doing a carotid duplex exam right here today. So we have two of our second year students. They just started in the cardiovascular sonography program 2 years ago, and they started in vascular sonography as their first modality here just this past fall. And already they know how on week 12 here they've scanned carotid duplexes, scanning the neck area. They've scanned the arms. or they've scanned the legs rather, the arteries and veins in the legs. And then next semester, they'll actually scan the arms. And then later on this semester yet, they'll actually scan the abdomen as well. So right here, we're showing you a carotid duplex exam. We can look at the carotid system in two different views. Right now we're showing you a transverse view. So it's kind of like taking a tree trunk and taking a section out of that tree trunk, and so you have just the rings of the tree there. And we're looking at one of the main arteries that takes blood flow up to the brain. Then we can actually move up a little bit further, and you'll see actually that that circle split into two vessels. One is the external carotid artery, the other is the internal carotid artery. One's going to take blood flow to the anterior portion of the brain, the front part of the brain, and the other is going to take and feed blood supply to the face and the scalp. And so we can also turn on this and actually stretch these vessels out in a long axis view. And this long axis view is kind of like stretching them out like a garden hose. And so we can look at the vessels stretched across the view this way. And so we look at it in this fashion. We put color on to show us direction of blood flow, but we do like to keep arteries red and veins blue, but they don't necessarily have to be that way. And then we can go ahead and add Doppler in here as well. Doppler is just like the Doppler that you would, like the rain and the weather Doppler. And this hit now, we are actually hitting against, not raindrops, but we're hitting against red blood cells. So we will show you that one more time here. And then we'll actually hit freeze. And we can actually measure the velocity, the speed and the direction of how fast that blood flow is going through the vessels. And so as vascular sonographers, we'll put all this information together, and we will put together a preliminary report, and we'll present that to a vascular surgeon, a radiologist, the reading physician, and then they'll make a final interpretation. So again, some of our studies, we can also use another type of transducer here, one that looks like this, and that can actually be used to do transcranial Doppler. So we can actually put it at different places around the skull and take a look at the circle of Willis, the 14 tiny vessels that make up our cerebral circulation. And we can use other transducers, such as one that looks more like this, kind of a curved. They can go for deeper vessels, such as in the abdomen area. The primary one is the one that Macy is using here. And so just a little straight across a linear, and we use that quite a bit. Again, on the neck, we can use it on the arms, we can use it on the legs. And we even do many other things in vascular sonography. Actually, just today we got done with our skills lab, and we were learning how to do lower arterial segmental studies, which is taking blood pressure cuffs, just like you'd go to the doctor and get it on your arms. Well, we can take blood pressure cuffs and put them all up and down the legs, and we even have tiny ones for the toes too. So again, a big variety of different studies that we do in vascular sonography. Macy, what would be one of your favorite things that you've learned so far in vascular sonography?
Probably just how to scan the carotid. That's my favorite scan so far.
And Rachel, if you want to pop your head up here, she's one of also our second year students in the cardiovascular sonography program. What has been one of your favorite things that you've learned in vascular sonography so far?
Honestly, probably the legs. I really do like the legs. I thought it was going to be challenging, but I like it a lot.
And so you heard it from two students here, a lot of different things, a variety that they get to scan and get to do and get to enjoy as well. And so they will actually tomorrow be within their core classes, their lecture courses. So they'll get to learn about this information, and then they get to actually apply it here in the skills lab on a weekly basis. And so I just want to thank you for listening to about vascular sonography, our portion of the cardiovascular sonography program.
I'm Dr. Mark Jones. I'm an associate professor at Bryan College of Health Sciences. I teach in the biomedical sciences program. I teach human anatomy, and I teach anatomy and physiology 1, as well as some other courses like I've taught pathophysiology. I also teach embryology and intro to Bryan. Today I want to talk to you a little bit about the brain and its function and organization. So what I have here is a sheep brain, and it's very important as we consider the function of the brain to realize that the anatomy of the brain is going to reflect its function. So basically certain parts of the brain process different kinds of information. So for example, we can look at the whole sheep brain. If you look, I can spread the fissure apart here, and you'll see that the sheep brain, and our brain's the same way, has two hemispheres, excuse me, a right hemisphere and a left hemisphere. And you may know this already. The right hemisphere is responsible for processing information that comes from or goes to the left side of the body. So for example, when you make a decision to move your left hand, that decision originates in the right cerebral hemisphere. If you touch something with your left fingertips, that sensory information goes back to the right hemisphere where it's processed and you're aware of it. So as we look at the brain, we have the two hemispheres, right and left, and then each hemisphere is broken down into further regions and lobes. So anteriorly, we have the frontal lobe, and then the parietal lobe, the occipital lobe, and then finally the temporal lobe. These different lobes and the different regions of the brain are responsible for processing different kinds of information. If we look at the frontal lobe is responsible for formulating motor commands, that is, decisions to move muscles, skeletal muscles in your body. It also is responsible for decision making and certain personality traits. If we go posterior to the frontal lobe, most of what the rest of the brain does is process different types of sensations like touch, pain, temperature, vision, hearing. So if we look at the parietal lobe, it has a region that processes somatic sensations like touch, pain, temperature, things like that. The occipital lobe processes visual information. And then the temporal lobe, one of the things that it does is it processes information related to hearing. Now, I just want to talk a little bit about the way that the brain processes information. So each part of the brain that processes sensory information has areas called primary areas. So in the occipital lobe, for example, there's a primary visual area. That's where information from your eyes comes to the brain and it reaches your conscious awareness, and you can describe features of what you're looking at. So if you looked at a person's face, you would be able to describe eye color, hair color, shape of their face. But that information isn't that important if we don't put it all together to make sense out of what we're looking at. For example, if you look at a person's face, you want to be able to identify that individual. So we need other areas of the brain to do that. They're called associational areas. So there's a visual associational area that puts together all of those things about a person's face, and it allows you to connect that to memories and emotions so that you can identify that person's face. So there's an area in human brains, and this is true for most animals, that allows them to process information about faces and recognize those faces, so facial recognition. There's a disorder, a clinical disorder, that results from damage to that associational area called prosopagnosia. And with that, you're not able to recognize people's faces. You could describe every feature of that person's face, but you would not be able to recognize who they are because you can't tie that information to memories and emotions. Ironically, you wouldn't be able to identify your own face in a mirror or a photograph. So anatomy of the brain is very important for understanding the function of the brain.
My name is Jeff Schwem. I teach chemistry here at Bryan College of Health Sciences. And I was just going to show you a little demo about how you can make the most common kidney stone in the laboratory. What I have up here, so making a kidney stone, it's basically just the chemistry of salts. And so what I have here is the balanced equation that occurs when you make the most common kidney stone, which is calcium oxalate. And that's one of the most common kidney stones that people get when they struggle with kidney stones. Now you can get more information about the clinical aspects of kidney stones from places like our Bryan Health blog. So if you just Google Bryan Health blog, understand what kidney stones are and how they form, and then also at Harvard Health, Cleveland Clinic, and then I believe this is University of Wisconsin Health. So the most common form of kidney stones are calcium oxalate. Oxalate is found in different types of food, such as spinach, beets, which I'm sure some people like to avoid, but also, unfortunately, potato chips and fries, which are foods that people probably don't like to avoid. So there's a variety of ways in which people who are prone to kidney stones are told to treat them. And of course, you need to talk to your own doctor for something like this. But in general, people will sometimes avoid oxalate foods. They'll avoid salt intake. But the big thing to do is to drink lots of water, because when you dilute your urine, that's probably the best way. And they tell people to drink lots of water. Some people have to drink, if they're prone to kidney stones, 2.5 liters of water a day, according to some of these documents that you can go read for yourself. But it's probably surprising, and I do this with my introductory chemistry class when we're talking about ionic compounds, that you can actually make the most common kidney stone in the lab just by mixing two solutions together. So I have here calcium chloride solution. There's no solid in there. And I have here sodium oxalate solution. And as you can tell, there's no solid here. So what I'm going to do is I'm just going to pour this in here like so. All right, that's the first solution. And then I'm going to pour the calcium chloride in. Now, some people, according to those documents, and you can see how drastic that is. So imagine that in your kidney. I try not to, actually. But some people, they get really nervous about taking in calcium. And so according to these documents here, they actually tell you that some people should have more calcium because it binds any oxalate that they might eat in the gut so that it's not absorbed into the bloodstream. And then if you have too much of either of these, you form kidney stones. So this is just an example of how general chemistry and general chemistry concepts can be applied to medicinal situations.
Well, thank you so much to all of our outstanding faculty and staff for your expertise and your knowledge, and for showcasing how Bryan College of Health Sciences really does truly value high quality academic and clinical learning environment for our students. Here now I want to just take some time to review a little bit of our cost of attendance here. This is a summary of tuition and fees. At Bryan, we are our tuition is calculated on a cost per credit basis. And so as you can see, our cost per credit rate is right at $5.97 per credit hour. And we then also have student fees, at which are calculated on a credit hour basis per semester. So any student less than 6.5 credits a semester is at that 300. If you are enrolled in 6.5 or above, the student fees are a flat $750 for that semester. So on average, students are taking between the 26 and 32 credit hours here at Bryan. For the estimated tuition and fees, their range, you can see on the screen here, between 17 and 20, depending on the credit load. So you should also expect a budget for textbooks, roughly $1,200 per year, plus living expenses on top of that as well. So how much aid are students typically eligible for? It does depend. It's very individual in nature, specifically when it comes to federal funding, which you can see from a federal Pell Grant. The federal Pell Grant is designed, it's a federal program designed to help accommodate and meet financial needs that students and families have to help them and attend and enroll in college. So those ranges can be anywhere from $650 all the way up to $63.45 for students per year. And then the federal government does have student loans that are calculated and averaged out over the course of the 4 years. You can borrow, those are maximum amounts of loan amounts that any one student can borrow over the course of their time in a 4-year time frame. We also offer parent loan programs, which basically is allowable amount up to the cost of attendance minus any other financial aid that's received. Parents can borrow to cover any unmet cost or fill in any unmet need areas for their student. We do have scholarship programs here at Bryan through our Bryan Foundation scholarships. We also allow students to bring in lots of scholarships that are outside of Bryan, whether those are local scholarships or national scholarship opportunities. We certainly encourage you to do that as well. On average, students are receiving roughly a little over $7,000 a year in financial aid support here at Bryan. So, housing and meals. All of our students at Bryan do live off campus, and that is certainly something that our students have found tremendous favor in. And so we facilitate that process and help guide students through that process in a number of different ways. We have a Facebook group that's just, I hope you will take advantage of if you decide to enroll at Bryan for incoming students, where they can interact and get to know classmates. We have events such as mix and mingle events where we help students connect and be able to form identification in terms of meeting new students who are going to be a part of their class and getting to know them. And then we really help facilitate that throughout the course of the summer as well, with a series of activities that help students connect and bridge into the start of their academic year here. On average, students spend roughly, as you can see, roughly about $500 a month in rent to be students at Bryan on average, with utilities being right around $250 per month. That can swing in either direction, depending on where you're living and, in terms of kind of your threshold as far as amenities go. All students have access to a really wonderful cafeteria here at Bryan. We have some incredible staff that work in the cafeteria and some incredible chefs that prepare incredibly delicious food. Students receive a 30% discount on all food purchases in the cafeteria. So, just want to take a moment to introduce you to our student affairs team here at Bryan. Really important, and they do really, really important things to support our students and their overall success here at Bryan. Dr. Alethea Stovall is our Dean of Students. Sherry Panites is our Clinical and Academic Development Coordinator here at Bryan. And Sherry just does a tremendous job of providing support services for students in the area of academics, whether it be peer tutoring, disability services for students, helping students identify study groups, helping students learn their individual study behavior and styles. And so Sherry does a tremendous job supporting our students academically. Mel Stutzman is our Professional Development Director and Counselor here at Bryan. Mel's a licensed mental health practitioner and a licensed alcohol and drug counselor. And so Mel works with students individually, providing counsel to them while students might be under stress, anxiety, simply just helping students navigate time and management and helping them reduce stress and helping them just be mentally well. Also on the team, we have Brenda Neiman. Brenda is our coordinator for student services. And Brenda oversees everything prior to your arrival, from new student orientation all the way through your departure as a student, and coordinates our graduation services. And then everything in between as far as activities and resources and student organizations, how to get involved and stay involved on campus. Melinda and Melissa are our health and wellness office, our student health office here at Bryan. And they just do a tremendous job of providing support, guidance, resources, information on immunizations, and just really helping our campus really stay healthy and well. And lastly, our financial aid team consists of Maggie and Bridget. Maggie's our director of financial aid and Bridget's our assistant director of financial aid. So they just provide all things support related to financial aid, whether that be helping you find additional funding through scholarships, loans, and repayment options. They're just a wonderful resource for students and families here at Bryan, helping them navigate the landscape of financial aid.